This program is a intergenerational effort. So often the Amherst Neighbors, puts on a couple of educational programs every month, but Raul Rajendran and his group at UMass are part of a group called Volunteers for Seniors. And so we've been connecting and looking forward to doing some things together, like today's workshop on foot care. Um, for those that don't know about Amherst Neighbors, um, very briefly, Amherst Neighbors is a neighbor to neighbor organization. We do volunteer support and educational programs um, that are designed to make sure that older adults can stay as independent as possible in their own home and in their own community. So on the volunteer services side, we do over 1,000 services a year. Somewhere in the neighborhood of 75 to 85 a month of getting people to medical appointments or to the food store, um, uh, helping people get food or run errands. In some cases, just friendly visitors or somebody to take a walk with, or somebody to help organize and declutter due to downsizing needs and maybe moving. So there's a lot of ways that we engage and interact with the 700 plus members of Amherst Neighbors. Um, on the educational service program side, we tend to do about 2 programs a month, and they range dramatically. We have one on Thursday that's writing your own memoir, a way of kind of leaving your story to the next generation. We've had great programs on nature and the moon, uh, uh, um, memory challenges, and other medical concerns and related issues. Anything that might be of interest um, to our members. So this program is a an effort that we're doing with Raul, and I'm going to let him tell you a little bit about Volunteers for Seniors and go ahead then and introduce the speaker.
Thank you
Rahul?
so much, Larry. Hi, everyone. My name is Rahul. I'm a rising junior undergrad at UMass Amherst, and I'm also the coordinator for youth and young adult involvement at Volunteering for Seniors, or VFS for short. I lead the VFS student chapter through our UMass club, which helps direct student volunteering in the elder community, and we also promote intergenerational programs such as this to connect youth with seniors. Thank you to everyone at Amherst Neighbors who helped set this workshop up. It would not have been possible without your deep commitment and dedication to serving the community. So I genuinely very much thank you for this opportunity. Um, I also want to thank Pratima Panumarthy and Ramakrishna Panumarthy, the founders of Volunteering for Seniors, for helping setting this up. Pratima Panumarthy is our executive director and someone whose compassion has been a deep inspiration to me as she's continued to lead VFS from the beginning. Before we kick off this workshop, I would like to briefly introduce our organization, Volunteering for Seniors. VFS is a service-based nonprofit organization that has been serving the senior citizen community since 2021, offering wellness workshops like these, along with other social engagement programs and community support programs. Again, all of this is entirely volunteer driven. We encourage you guys to participate in other such programs that we offer. And if you would like to stay connected and be added to our email list, please send us an email at info@volunteeringforseniors.org. I'll also put this email in the meeting chat box, so don't have to worry about it right now. I'll leave it in the chat box, which you can access at the bottom of this Zoom meeting screen. Um, and yeah, so I'll include that as along with our website information for you guys to check out our other programs and stay connected with our mission. Now I'll be turning it over to our speaker, Dr. Sam Gorelick. Dr. Gorelick is a podiatrist working in Aronson Foot Care in Canton, Massachusetts. Dr. Gorelick has also been a wonderful volunteer instructor with VFS for the past 2 years. He's generously conducted multiple free workshops on podiatry for our seniors, which is also where I myself have met him for the first time. He's always offered his expertise with warmth and compassion, and since joining our mission, he's been an integral part of our health and education efforts. Thank you, and on to you, Dr. Grelly.
Hi, thank you for the introduction. So it's nice to meet everybody. My name is Dr. Gralick. As Rahul mentioned, I'm a podiatrist working out of Canton, Massachusetts at Aronson Foot Care. I grew up in Massachusetts. I grew up right nearby in Sharon, Mass. I definitely have some connections with Amherst as well, as my sister went to UMass Amherst. I did my training out, well, more in the Worcester area, but my sister's been through the whole UMass system, so that's been kind of an integral part. This is always nice to kind of help out with seniors throughout the state. I find that education is very important in making sure that people stay healthy, as people live longer and longer, and I want them to live long, healthy, and happy lives. So I can begin from there. So I'm first going to start with what in general is pediatric medicine. Um, Rahul, if you don't mind going a couple slides,
Yes, sorry about that.
no problem. One more. So pediatric medicine. So this can be sometimes a little bit complicated, in Massachusetts specifically, but in general, podiatrists, we're trained to treat everything, pertaining to the foot and the ankle. Within pediatric medicine, there's a variety of subspecialties that people go into. Those can include sports medicine, pediatrics, geriatrics, surgery, and general foot wellness, including diabetic foot care, etc. Your podiatrist plays a very important part in the medical team. I oftentimes work with their primary care providers, endocrinologists, vascular doctors, infectious disease, etc. A lot of podiatrists as well, although they include these subspecialties, many times they are seeing a variety of patients, both pediatrics, geriatrics, surgery, routine care, things like that. Um, and so basically, why is foot care important? So basically, 1/4 of all the bones in your body are located in the foot. There's several bones, several joints, ligaments, muscles, tendons, nerves. And the issue is that as we get older, your body has to deal with the wear and tear of walking 8 to 10,000 steps a day or 115,000 miles in a lifetime. So oftentimes I compare your foot to a car. You know, your car needs maintenance as long, in addition to your feet as well. So it's very important to keep those feet healthy. And so over time, this is kind of showing, feet over multiple generations. You go from small to having bigger feet, soft skin to kind of harder callous skin. In addition, obviously, footwear is very important as well. On footwear, both, can play a significant role in the health of your feet. And shoes have always been a very important part in our lives, in media, in movies, and stuff like that. Rahul, if you don't mind going to pictures. Yeah, so, and of course, those pictures, that's a very classic Wizard of Oz, that's very typical of, shoes always play an integral part in both our lives and media and stuff like that. So basically, to start off on what to keep an eye on. So at the very basic levels, just routine care of your feet. As you get older, it can sometimes become difficult to take care of your feet, whether it's trimming your nails, whether you have corns, calluses. When toenails get long and thick, they can become very painful. They can start to crack. It can become difficult to put your shoes and socks on because the nails can get stuck on the socks as well. So that on the very basic level, what we start off with is just routine care, whether it's trimming up nails and calluses. And then from there, we discuss different skin issues when you see a podiatrist. So this can pertain to rashes in your skin, discoloration, dry, scaly skin. People can get fungal infections both in their toenails and athlete's foot as
Listening
well.
to this.
In addition, calluses, corns, and warts, different items like that can be easily treated if they're seen soon enough. So in that picture that you see there, it's a typical callus that can present on the bottom of your foot, and it doesn't always matter how. Raul, if you don't mind going to the next slide. Um, Oftentimes it's not even the size of the callus that can be a sign of how painful it is. Many times people come in with a very small callus or a corn, and then when I take off or shave off that callus or corn, I've changed their whole lives because now they can walk again without discomfort. So things like that are reasons why you should see a podiatrist to take care of that stuff so you can get back to your regular activities, walking, dancing, whatever you're doing in your free time. Because it's important to stay active in order to stay healthy for longer. Another key part of what we deal with is diabetes. So diabetes affects, on here it says 25 million in America. Definitely there's a lot more. It's increasing from year to year, unfortunately. And as we get older, type 2 diabetes is affecting a higher percentage of the population. I would say probably the majority of my patients are diabetics. And so with that, that can present with a lot of complications in your body. And oftentimes complications can present first in the feet. Many times I'll see people coming in where they have some numbness and tingling in their feet. I have them go see their primary care doctor, and then they find out that they do have diabetes. And they were first notified or warned about that by seeing a podiatrist. So the issues with diabetic patients, it really comes down to numbness and tingling. So diabetic feet, they need special care. The reason why is because oftentimes they can't have good feeling and they don't have good feeling in their feet, and this can lead to it being unsafe for patients to take care of their own feet. I don't want diabetics cutting their own toenails, taking off their own calluses, because if they end up nicking themselves or have a small cut, that can lead to an open sore, an ulceration, that can lead to an infection, and unfortunately to an amputation in some cases. And many times, the vast majority of these amputations are often preventable. So preventative care is the most important thing you can do for your diabetes and to take care of your feet. So many times people who are diabetic, they'll get this dry skin, they're fissuring in their feet, and so it's very important for them to have their feet be well moisturized. So as I mentioned before, so tingling and numbness. So many patients are diagnosed with neuropathy. This can present in the hands and the feet. They often present with numbness, tingling, and it can progressively get worse without treatment. Treatments can include specific medications, whether it's your insulin, whether it's supplements for the numbness as well. Exercise and laser treatments can often be used to treat the numbness and the neuropathy. So neuropathy, as I mentioned before, diabetics can develop this peripheral neuropathy. Now, neuropathy can be seen in a wide range of patients, not just diabetics. In the older population, a lot of people have vitamin B12 deficiencies, and that can lead to a lot of neuropathic symptoms as well, which is why a lot of people are being put on vitamin B complexes as you get older. And the biggest issue is that when you have neuropathy, you can't feel the bottom of your feet, and that can lead to you walking with maybe a pebble in your shoe or you have a callus and you just don't realize it until things go south. And it all starts from you having that neuropathy where you can't feel your feet. So it's very important for anybody with neuropathy that you need to be checking your feet each day for any changes. And so I always describe that as the gift of pain. The idea being is that when people have pain in their feet, it means that something is wrong. Pain isn't normal in your feet. And so it's very important that if you have the pain, definitely go see somebody. But the issue, if you're a diabetic, you're not going to feel that pain. And so you only realize that it's a problem until you won't realize that it's a problem until it's too late. So that's why I say it's important to check your feet every day. Either yourself with a mirror or whoever you live with or somebody else should be checking your feet. Another aspect that's very important is peripheral arterial disease. So as we get older, unfortunately, many times our circulation gets worse. This can present in a variety of ways. It can present in aching in your legs as you're walking. It can present as pain in your legs that are relieved with rest, cramping, discoloration, cold feet, wounds or cuts that are slow to heal, and many more symptoms. Oftentimes, what I see in patients come in, they present for just maybe even just regular routine care for whether nails, calluses, or other issues. And then I have a trouble feeling their pulses. And then as I further explore that issue, I find that they should be seen by a vascular doctor. So I refer them to see a vascular specialist, and then they do further testing on their feet. And they can often identify issues with their circulation that can be treated either with medications or in some cases with procedures, whether it's endoscopically or whether it's with a bypass. So in this picture, that's a common test that's done where they put blood pressure cuffs on different parts of your lower extremities, and it compares the circulation, your blood flow. And assuming that you have no circulatory issues, then the idea is that your blood flow should be the same at each of the segments of your legs. Now, you are more likely to suffer with peripheral arterial disease if you're over 65, if you're diabetic, if you smoke, if you have high cholesterol or blood pressure, or if you're overweight. And so, many people suffer with these items. So that's why it's important to see somebody for that. Now, the importance of prevention in the diabetic foot. So this all goes back to avoiding infections and avoiding cuts and ulcerations. And these statistics are always being updated, and unfortunately, they're usually getting worse, not better. So an estimated 15 to 20% of the diabetic population will suffer with an ulceration, and 10 to 20% of those will lead to an amputation. And the vast majority, 50 to 70% of amputations are preventable. Diabetes continues to be the most common underlying cause of all lower extremity amputations. So how do we prevent it? So number one is when you see a podiatrist, never ignore a problem. Whether it's a cut, a sore spot with drainage, swelling, bruising, pain, don't hope that it'll just go away. See a podiatrist and have them evaluate you. I would much rather someone come to me and me tell them everything's fine. I'll see them in a couple of months versus them coming in and be like, you know what, you should have come in a couple of weeks ago. Now I have to send you to the hospital. So early detection is key. Oftentimes people come in with these with these big wounds, and oftentimes cases like this is likely something developed over time. And this person in particular likely had something called Charcot, which is essentially when your your bones are breaking apart and you just don't feel it. And that can be that person can likely be looking at an amputation soon if that wound doesn't heal very quickly. So the ease of prevention. So in addition to visiting your podiatrist on a regular basis, it's important to wear shoes that fit properly, that are well supported. Once again, you should wash and inspect your feet daily. And I'll definitely be repeating things that are important. So once again, inspect your feet daily. Moisturize your feet with a medical grade formula safe for diabetics. And wear socks that are roomy enough and allow your feet to breathe. Many times people will come in and they'll get diabetic socks. The nice thing with diabetic socks is that they don't have a tight band to them, because that tight band can lead to wounds and issues for diabetics, because if it causes too much pressure in your calves, that can lead to wounds around that area as well. So using the right products, this is just an example of some of the things that we have, whether it's soft pumice stones, lotions for your feet, diabetic shoes. These are all different options of things we offer in our office, and many times podiatrists will offer in their offices as well. So in addition, be aware of your benefits. So as a diabetic with Medicare and some private insurances, you may qualify for a pair of therapeutic shoes and 3 pairs of custom inserts each year. Typically, the way that works is someone will come in, they'll have diabetes, we check their insurance, and as long as they have some sort of at-risk issue, whether it's calluses, whether it's hammer toes, bunions, that'll allow them to get, these diabetic shoes, which a lot of them there's a lot of benefits to that. So as I said there, we'll examine you through a comprehensive diabetic foot exam, whether you have neuropathic issues, deformities, circulation issues, basically anything that puts you at risk for developing a callus and eventual ulceration. There's a lot of different choices. Of course, every office is different. Once you come in and it's determined that you'll benefit from a pair of shoes, we size you and get the width of your feet, get into a right pair of shoes. Then we send letters to your primary care doctor to confirm that you do have diabetes and you're being treated by a podiatrist for that. And Rule, if you don't mind going to the next slide. And then according to Medicare, basically the PCP must sign that, essentially stating that they're treating you for diabetes and you do qualify for the risk factors. So as I said, there's different styles. Now you might ask, why would Medicare want to pay for shoes? Now, no insurance company is going to want to pay for anything they don't have to. It all comes down to finances. So they determine the cost of what it would take to cover an amputation, hospital visits, multiple surgeries, versus paying for shoes. Now, the idea behind all these shoes is number one, they have these inserts. The shoes are softer, they accommodate different sizes and widths, and this will allow you to continue to walk while not putting yourself at further risk for developing these calluses. Because once you develop these calluses, they can lead to ulcerations, and that's when that can lead to amputations and other issues. So if they can get you into a pair of shoes, that'll be a lot more cost effective and a lot better for you as the patient. So now separate from diabetics and diabetes, another part is trauma. Many patients will go to the emergency room after stubbing a toe, falling, sustaining some sort of injury, twisting their ankle. This can lead to bruising, swelling, and pain. And Raul, if you don't mind going to the next slide. And so when people have trauma, they end up requiring different devices, whether it's a brace, whether it's a boot, things like that. And oftentimes they do get this in the emergency room or urgent care. Many times they'll come to our office after falling, and then we fit them for that as well. And the issue as we get older, everybody wants to stay active, but the issue is you may not be as stable now as you were 20, 30, 40, 50 years ago. Many times people are coming into the office using canes, walkers, and people are using those because obviously they're not as stable as they used to be. So many times through the proper use of devices, whether it's orthotics, braces, normal everyday activities can become easier and more enjoyable. So just like foot pain shouldn't be ignored, neither should ankle pain. And just someone telling you, oh, you have arthritis, kind of deal with it, that's not really an answer. And so this is one example of a brace. Braces are definitely range. The issue as well with that is balance problems. And so what you see in that picture is a balance brace. So what we always ask them is, do you or a loved one have problems with balance? Do you suffer from dizziness that makes you feel unsteady? Do you feel as if you have to hold on to furniture or walls when you walk? And do you use a cane or a walker? The vast majority of my patients who are over 65 do answer yes to most of these questions, if not all of them. So podiatrists can help with all that through getting you fitted for these custom braces. Basically, we do a fall risk assessment to determine if you're at risk for falling. And that's where the balance brace comes into mind. Now, the next step is foot deformities. So a lot of people have bunions, bunionettes, hammer toes. And a lot of times they can just be treated conservatively through proper shoe wear, padding, adjusting your shoes, modifying your shoes. Now, in some cases, surgery may be an option, and many times the recovery period is a lot less than you may think it would be. But of course, before surgery, we determine what would be best for you. And I'm always surprised when people come in. People come in with holes in their shoes. They just cut it out and they say, "Oh, it doesn't bother me." And if it doesn't bother them, it doesn't bother me. But it's important to still be evaluated because many times they've been dealing with this pain for many years and they've just been living with it. And so this is an example of a bunion. We deal with this every single day in the office. Now, separate from bunions, people come in with heel pain or arch pain. Now, this is something that can be treated pretty easily with icing, stretching, orthotics, things like that. And a big part is education for all this. I educate them on proper shoe wear, inserts, going over specific exercises for them, getting them to any specific splints, things that will help them stretch out that Achilles and stretch out that plantar fascia on the bottom of your feet. The biggest thing is I have them point to where they feel the pain is the worst, and that gives me a lot of information on how I will treat their discomfort. Now, the next part is flat feet or high arches. That goes along with the idea of deformities of the foot. I would say most, flat feet is more common than having high arches, but those are both very common, and those both can be treated pretty easily with either orthotics, exercising. In some cases, people do end up requiring surgery, but this is all part of the evaluation that will occur when you see a podiatrist. In addition, be aware of inserts that you may buy in the store because oftentimes it may overgeneralize it. And unfortunately, many stores these days kind of advertise themselves as kind of providing medical grade inserts or orthotics. They can often be several $100s, thousands of dollars people pay for it. Unless you're being treated by a podiatrist or you're being seen by a medical provider, I wouldn't necessarily consider that as a medical grade insert or orthotic, because at that point it's just an associate, store's associate treating you for it. So these are some examples of different orthotics we have in the office. They all range depending on what the individual needs and requires. So once again, it all goes back to general foot pain. So foot pain is not normal. If you experience foot pain, discomfort, achiness, swelling, or find yourself saying, my foot is killing me, there's really a whole show that's called Doc, My Foot is Killing Me. The key for all this is go see a podiatrist. Foot pain isn't normal. In many cases, people come in for just getting a general evaluation. People come in ranging from, more routine care to a trauma to diabetic care to infections, and we treat all that stuff in the office. So what it all comes down to is go see a podiatrist and see what we could do for you to get you back on your feet. Do you guys have any questions? I know I gave you guys a lot of information there.
This is
Yeah, go ahead.
this is Elisa. I don't actually have a question. I just want to say that decades ago, I got some plantar fasciitis. I saw a podiatrist. I got inserts and it cured the problem. So I definitely believe in going to see podiatrists for something that involves the foot.
Yep. Yeah,
Raul?
so yeah,
Go ahead.
exactly. It always amazes me when people come in, they've been dealing with things for months, for years. They'll come in, whether they'll say, oh, somebody's telling me it's just arthritis. And unfortunately, as you get older, people will just essentially say that about, oh, you have arthritis, kind of just deal with it. That's never an answer. Now, can I make your feet look like they did when they were, when you were 30 years old? Maybe not, but I can definitely get you back to walking without pain. That's the goal of all of this. And the key is to get evaluated. As I said, whether it's inserts, maybe it's inserts, orthotics, and stretching is all you need. But it's important. Any sort of foot issue, any ankle issue, those are all things that a podiatrist can treat.
I wanted to put a plug in for folks to be able to either raise their hand or engage in the conversation with questions, but we can't see many of you. So if you make yourself visual and then put your hand up or the other Zoom hand, either way, we can get a good conversation, starting with whoever the name iPad is who needs to be unmuted.
Okay, I don't know why my name didn't show up, but it usually does. My name is Hilda, and I have a neuropathy in my feet, and I'm starting in my left hand too, and I got told by neurologists that there's nothing you can do about that. And so I'm asking, what do you do to treat neuropathy that the neurologist doesn't know about?
Yeah, so basically there's two parts to it. So number one, identifying what the cause of the neuropathy is. So for example, if you have neuropathy due to a herniated disc in the back, I can't
Yes.
treat the herniated disc. But there are other symptoms that I can help treat. And separate from that, it's not just the neuropathy that I'm concerned about. I'm concerned that you have trouble feeling your feet. And the issue is you might not realize, like you might have a callus developing and you just might not notice it. And you might not notice you might have a cut on your foot and you won't notice it until you're walking and your sock might have blood on it or something. So that's another reason why I have people come in that they have just neuropathy from other sources, and they just come in just to get their feet checked. And I think that's definitely very valuable because I'd much rather them come in, and some of them might not be able to see the bottom of their feet, or they want to get it checked by me. So that's one part of it. Now, the other part about treating neuropathy itself, there's different ways to treat it. Now, everybody's different. Some may require multiple treatments. Some may help. Some may not 100% help. So typically, the way we treat neuropathies, as I said, finding the root cause. There are, supplements that we provide in the office. I did mention vitamin B12 deficiency, so dietary issues. If people work specific jobs, they could get exposed to certain chemicals that can cause neuropathy. So finding the cause of it is important. So as I said, supplements. In in my office, we do laser therapy for neuropathy. And I've definitely found that to be helpful for some people. Now, it's not for everybody, but I've definitely found relief from it. We do often
What
work
is
with,
that, please?
sorry,
What
say
kind
that
of
again?
what did you just say? Laser?
Laser therapy, yes.
What do you
So
laser?
so we do laser over the whole foot. So basically, the way that works is that essentially the issue is that your nerves aren't working properly. So neuropathy comes in different stages. In some stages, people can have hypersensitivity to pain. In some cases, it can be almost like a tingling sensation. In other cases, it can be just completely numb. And so what the laser therapy does is sort of activates the fibers in your nerves, and it almost makes you go back, it reverses some of it. So for example, for people who are very hypersensitive to the pain, many times the laser can kind of calm that pain down. I've done laser on some people who have complete numbness, and they start to have some numbness and tingling. So that means that the neuropathy is kind of going backwards a little bit. Now, I'm not going to say that, oh, you come in, you have really bad neuropathy, you have numbness, I'm going to do a laser on you, then the next day you're all better. It takes time, you have to be patient with it, but that's definitely an option. Now, in some cases, I have sent people to other neurologists as well, where they've tried different therapies and it just wasn't effective for them. But I always think it's worth at least trying because it has worked for several people.
Thank
Sandy
you.
had a hand up. Sandy Roth.
Yeah, I have a question about Achilles heel rupture. I mean,
Sure.
Achilles tendon rupture.
Yeah.
I ruptured my Achilles tendon about 18 months ago and wore a boot for 3 months, and the tendon healed. But since the tendon healed, my left foot is really not stable the way it used to be.
Uh-huh.
Um, and going upstairs is almost impossible. I can't push off with my foot,
Yeah.
and going on uneven surfaces, my foot is not, I don't know, I'm just not kind of knowing where I'm at. And I'm wondering if podiatrists have experience with those kinds of problems with Achilles tendon.
Yeah, no, definitely. Yeah. So when people come in with Achilles ruptures, there's always two ways to treat it, conservatively, with a boot, or surgery. Now, when we go conservatively, number one is very important physical therapy. That's crucial to the recovery process because without it, it will scar down and it'll be very tight there. And even with physical therapy down the line, you may need physical therapy in the future again as well. Just because the issue is that the area does get very tight and it does scar down. Separate. So long story short, podiatrists do treat it. In our office, we use something called shockwave therapy. What that does, it actually creates little micro tears in the tissues, and that can actually stimulate a healing response. And I found that can be very effective, especially for that long-term tightness, and that scar that people may feel after an injury like that.
Thank you.
No problem.
Again, this is an opportunity. We see about half of you. We don't see the other half. So if you have a question, please chime in. And I think, am I seeing a hand? Okay, go ahead, Ms. Patel.
Yes, I have a question regarding what is the plantar fascia and motor neuroma. So in between, I had a problem 2 years ago, and then doctor, I saw a doctor, and he put a cortisone injection, and it helps me for 2 years. That one injection,
Yeah,
and now we started again in one fit, same fit again. So how often you can take that cortisone injection? And now actually both feet started in a front, that
yeah,
toes, the front side, not the heel part. Heel is not hurting, but the front one.
I
So
see.
should I go for another injection, cortisone injection? And what is different between plantar fascia and motor neuroma?
Yeah, so first with a cortisone, I typically tell people I wouldn't do more than three in 1 year. So if you had one and it lasted you 2 years, I would definitely go for a second one. I would say the one negative with steroids is that it can weaken the tissues. So, for example, if someone comes in and they have pain in the back of the heel, like right where the Achilles attaches, I won't inject steroid into there. That's like my one, I definitely wouldn't, just because now maybe some will, but I personally don't. The reason why is because, as I said, it can weaken the tissues. So for certain areas, for example, in that back area, I wouldn't want to risk rupturing an Achilles. Now, when you inject on the bottom where the plantar fascia is, worst case scenario, if you do rupture the plantar fascia, it's not the end of the world, and that will actually help long term. So I would say I normally don't do more than 3 in 1 year. So if one lasted you for 2 years, I would definitely go for a second one. Now, it may not last you as long, or it may last longer. Everybody responds to steroids differently, and your body's changing as well. Now, plantar fascia, what that is, or plantar fasciitis, on the bottom of your foot, you have kind of a band. It's kind of like a ligament, and it goes from the back of your heel to the front of your foot. And what can end up happening is as we go about doing our regular activities, that band can get very tight. And when that gets tight, that can lead to inflammation in the area. And that's why they call it plantar fasciitis. Now, many times people use it as a blanket term. Everybody comes in, oh, I have plantar fasciitis, I have plantar fasciitis. That's not always the case, but in some cases that can definitely be the case. Right on the bottom of the heel. It's usually worse in the morning when you get up from bed and things like that. Now, a neuroma is a little bit different. Now, a neuroma comes from a nerve that is often seen kind of towards the front of your foot, kind of in between your toes. Basically, what that is the nerve itself gets irritated and it gets swollen. And when the nerve gets swollen, it gets compressed by the bones next to it, and that can cause pain. It can feel like there's a pebble in your shoe. It can feel like almost like a rolled up sock under your foot. It can cause some numbness and tingling in your toes as well because it's a nerve. And that can be treated different ways. Steroid injections, orthotics, shockwave therapy. Sometimes people need surgery and stuff like that.
So more pain I have in the front, that means called is a neuroma, motor neuroma, right?
So Morton's neuroma is a specific name for a neuroma that's in between your third and fourth toes.
Mm.
It is a neuroma. They just in every single specific area, it's called something different. That specific area is just the most common one, and there's a doctor back in the day with the last name Morton, and he named it after himself.
Thank you.
No problem.
Diana has a question.
Yes, I do. I have bad hammer toes, and they cause a lot of pain, and I even see a podiatrist, but one toe can have the nail impacting on the toe next to it, and I'm using cotton all the time to try to space them so they won't touch each other. But I'd be interested to know if you have suggestions about footwear that would be better than what I'm using, or um, any other suggestions for very bad hammer toes.
Yeah, so when someone comes in with bad hammer toes, so the first thing we look at are the shoes, obviously. Now, unfortunately, I'm not located in Amherst, but where I'm located, there's actually a shoe cobbler near me, and I send a ton of people his way. And maybe there's a shoe cobbler somewhere out in Amherst, I just don't know. The reason why is because sometimes the shoe that you have, it may be a good fit, but it may need to be just slightly widened in one direction. And there are people out there who can actually modify shoes. Unfortunately, they're few and far in between. If you can't find one, what you have to look for in your shoes is the number one, the toe box has to be wide, and try to find ones that the material is a little bit more, has more give to it. You don't want to wear anything tight because your toes are gonna be rubbing on the top of it.
Right.
Now other things as well is there are different pads that we either have in the office or I make my own pads as well. They're called toe crest pads, but every podiatrist is different in that regard. They all have different pads and stuff like that. So padding is the next step. There are various procedures that we do for it. Some are done in the office, some are a little bit more invasive. It all depends, the patient, the level of pain, age, health, and a bunch of other stuff.
What was the name of the foot store that you mentioned? That
Well, it's a shoe cobbler.
shoe cobbler. Oh, I see. So, okay.
if there's one there, I would definitely let this group know, and I'm sure his business will double, or her business.
There is a
Unfortunately,
cobbler in Amherst. There, I don't know, I mean, I've taken shoes to him. I think he's still in business. He's under the Chinese restaurant at Boltwood
In there, but
in Amherst.
yeah, I
Yeah,
know Paul.
yeah.
Yeah, Paul, that's right.
Paul,
He's underneath Panda East. I don't know
And
what he does or doesn't do, but he's the only one locally.
right. But I don't know. I think he's pretty good. I don't know if he can do really complicated things, but it's worth checking him out.
Yeah.
but yeah,
Uh,
I mean, I would at least start with a wide toe box, and if you can have a higher toe box as well. The
yeah,
higher toe box is a little bit hard to find. And you could even ask the associate, but unfortunately, half time the associates don't really know what you're talking about. But at least a wide toe box, start with that, because as you can imagine, if it's narrow, then it's just gonna push your toes together and just make it worse.
Is
and
it possible to get those diabetic shoes without being diabetic and willing to pay for them that are
Um, at least
that are
at least in
wider
my
and softer?
at least in my office, yes.
Uh-huh. Because that
Um,
might be a good option for getting a good toe box.
yeah,
but
you know,
you can see when you go online and you look, and I've spent a lot of time doing this. There are shoe companies that say they have a high toe box, but it's really not. Or
yeah.
there's a certain amount of stretch, but there really isn't. So I'm just in the process of returning a pair of shoes for exactly that reason. Others are better.
So what I would say too, now as I said, every podiatrist is different. So I make my own hammer toe pads. I make my own because you can adjust them as needed. Basically the idea that so oftentimes when people have hammer toes, it's usually one of two things that bother them. It's the tip of the toe when you're walking pushes down and you get a callus there and that hurts. The other part, which can sometimes be more annoying, it's the top of the toe that's hurting. It's rubbing on the shoes and stuff like that. Now, what I personally like about my own hammer toe pads is that you can put it either way. So it looks basically the idea is the pad can go on the bottom or you can put it on the top. And the idea of it is so that when you're walking, I want your shoe to be hitting the pad instead of your toe. That's the idea behind it. You can try to find different hammer toe pads out there, and it sounds like your problem is more on the top of your toes. So you could try flipping them and seeing if it can stay on there. I find that the store-bought ones, they don't function very well like that.
They don't.
I wanted to read a question from the chat,
Sure.
and I will get to our friend iPad. Um, I'm multitasking, so I'm not on camera. What type of insoles do you like for flat feet with a toe migrating laterally? The ones I have don't fit in normal loafers very well.
Yeah, so what I would say, number one, it's hard to just give a blanket statement for inserts and stuff like that. So what I typically say, at least in our office, we have essentially three kinds that we use. We have prefabricated inserts. So those are ones that were pre-made. And someone comes in, I ask what your shoe size is, and then I fit them for it. There's like two or three different types. The next step above that are custom inserts, where we heat them up, we make them for the patient, and they get them the same day. And then a step above that is ones that are, we use an iPad where we take a scan of your foot, and then that's made by a lab.
Hmm.
What I would say for anybody, if you've already had inserts and they don't work, I would say the next step would be more of a custom insert. The issue with the prefabricated inserts is, as you said, they don't fit in all shoes. So I have different kinds of orthotics that I made myself from different companies, from different people, whatever. In my dress shoes, they're just not going to fit in there. They're not going to be comfortable. So I have a specific one so the ones that we make are thinner and they can go directly into it. And I wear them in my dress shoes and stuff like that. So you may be looking at more of a custom insert, stuff like that.
Okay, that was for our friend Sarah. One other question in the chat. What do you think of the nursing foot services that go home home to home. It sounds like a home health nurse. I am a nurse, not sure what a podiatrist would want to see happening.
Yeah, so I would say the reason why there's obviously a need for that. Back in the day, maybe 20, 30 years ago, podiatrists used to do house calls. When I first started, I did a couple house calls to nursing homes and stuff like that. It just gets too much to balance between being in the office and doing that, and insurance payments can be a little bit tricky as well. There's a lot of people out there. There's actually a nurse around here that I've sent people to her where she does house calls. She specializes in foot care. Um, and that's what we should, people sometimes they just need their nails cut and they just can't make it to a doctor's office, and that's fine. I would say, so the biggest thing with that is that number one, obviously cutting the nails, stuff like that. Anybody who's diabetic, and I'm fine with the nails getting cut by someone who does them on a regular basis. The issue is they really should be seeing a podiatrist to be ruling out them to be at risk for something. So, for example, I guess I think the person said they are a nurse. So
Yeah.
if you're seeing the person, you're cutting the nails, or someone's cutting the nails, getting the calluses, stuff like that, that's fine. As soon as they have a cut or a wound, I would recommend for them to be seeing a podiatrist. Just because I'm not as concerned about, oh, like I really want to cut people's nails. I get more concerned about the wounds and if they get infected. And then especially if they're diabetic, they really need to be seeing somebody at minimum once a year. Just like you see a dentist, you should see a podiatrist, especially if you're diabetic.
Well, just to emphasize your point about infection, my brother, who's about 77, called me to tell me he's been in the hospital from Tuesday to Friday due to he described athlete's foot type cracks, and infection got in his bloodstream, and he was very sick, and he needed IV antibiotics and the like, and now I guess his leg, the remaining part of it is like a cellulitis or something.
Yep.
So it's to be taken very seriously, I gather.
Yeah, as I said, unfortunately, as people get older, your immune system isn't as strong as it used to be. And so things can go south quickly, unfortunately. And and I do cover a hospital. I'm really the only podiatrist at the hospital here. And so there's certain people we call kind of like frequent flyers that I've seen them maybe like 20 times, 18 of them have been in the hospital, maybe twice in my office.
Yeah.
But there's also people that I see in my office once every 3 months. And it's very rare that those people are in the hospital for an infection because I'm seeing them on a regular basis. And I tell every diabetic, if you see a new cut or a new wound, call me. I'll fit you in to make sure that it's fine. Unfortunately, some people are sort of their own worst enemy. Like they'll come in they have a new cut somewhere. I don't know, like they cut their hand, they cut their foot on something. They said be obviously very careful. Um, Depending on your area, as I said, I know some podiatrists out there. I know them, obviously. I haven't been in their office and stuff like that. I would say with any sort of doctor, you do have to sort of, personalities have to gel and stuff like that.
Yeah.
Unfortunately, there's not enough podiatrists out there in general. Like, where I am, I think my patients like me, but also if they didn't like me, there's not that many people around here either. And so, you have to kind of balance it out. I would say the biggest thing is, see somebody,
Yeah.
and stuff like that. As I said, I can't see the chat. So if
Yeah,
there's
so
any other,
I was going to ask the person again who had their hand up iPad, do you want to ask a question or not? But you're muted.
Oh, well, I just put it in the chat.
Oh, you did. Okay.
And one that I was recommending, Drew's shoes that I buy all the time because they fit an American foot, which the ones that are sold by the people in Northampton and South Hadley are made in China, and they don't fit an American foot. They're short and wide, and I have a long and thin foot. And so Drew also has some very deep ones, and they also have lots of styles that are like sandals that have open toes or have cloth type toes. So you might want to check out Drew. Diana, it's Hilda, and I can tell you about it if you call me later. And the other thing I want to say is that I've tried various podiatrists around here all over the years, and they seem to have disappeared. Does anybody have a recommendation?
Well,
Um,
that's a good question. Does anybody on the call seen a podiatrist and or no, or have otherwise good feedback to share for local podiatry?
I
Uh,
go to a practice called DeCaro. It's over on the border between Northampton and Hatfield on that road where there's all those doctors' offices. This one happens to be behind another building, DECARO. And there's several podiatrists who work there. I don't know of any others. I agree there used to be more and they retired or whatever.
so I actually know Louis DeCaro. He's actually the one person I know in the area.
Uh-huh.
He's very good.
Yeah,
He does specialize in pediatrics as well, but he sees everybody.
yeah,
I talk to him all the time. I'm actually going to be seeing him in a couple of months at a
okay.
conference.
Yeah,
But he's great out there. Um, but yeah, as I said, I think the nice thing having these sort of groups is I feel like once you ask around, someone's going to know somebody.
yeah,
But yeah, I
yeah,
would definitely give my recommendation for Louis DeCaro.
yeah, yeah. And I'm blanking on the name of the person who works with him that I see, who I also like, and I can't remember his name, which is embarrassing. But anyway, yeah. But there did used to be others, and they retired or moved
Yeah,
away, whatever.
it's the same thing in my area too.
Yeah.
The other doctor is Dr. Pacnia, that's in DeCaro's
Right.
practice.
Yes, that's the one. Yeah, I like him.
And that information is in the chat for anybody that's interested. I see the Decaro demographic information, so feel free. Dr. Garlick, you can you touch a little bit on toenail discoloration, and is it a big deal or not if it's not there's no discomfort, no pain, no nothing other than periodic discoloration. Is that a concern? I see commercials about products on TV. Give us a little education in that area if you can, please.
Yeah, so basically when someone comes in and they have thickened, discolored toenails, it looks yellowish, brownish. Typically it's fungus until proven otherwise. But the so sorry, but that doesn't mean that it's always fungus. But let's say it is fungus. So number one, what I tell them is you're not gonna be well, I think was it your friend or your brother or something who was in the hospital?
Yeah.
But you're not going to be in the hospital for fungal toenails. And if you are, then the hospital is doing something wrong.
Mhm.
But, so the worst that will happen with that is that sometimes people get athlete's foot. Like, where it's just the feet get itchy. But long story short, when it comes to just fungal toenails, the first step or the easiest treatment is I would say, go see a podiatrist every 3 months. I trim I debride their toenails. I keep them nice and a little bit shorter. I file them down to make sure there's no sharp edges. And that's the easiest thing. There's no risks involved with it. And you kind of just go from there. And that's perfectly fine. People don't realize the percentage of the population that has fungal toenails is very, very high.
Mm.
Of course, everybody's going to be self-conscious of their nails, and and that's perfectly normal. But that's one part. Now, other ways to treat it. So there's topical medications. I would say on average, their a success rate is about 20 to 30%, and it needs to be applied usually twice a day for about 90 days at least. There are oral treatments for it, which is that's usually the most effective, maybe 70%. Now, that doesn't mean that it's not going to recur later. And in some cases, that can affect the liver as well. There's also laser treatments. And in my office, we started this new therapy. It's called LED light therapy for the fungal nails. Now, with all this in mind, it's perfectly fine to just not do anything. Now, would I empty out my life savings to treat my fungal toenails? Probably not. Could they get painful if they get very thick and long? Yeah, they probably could. And that when it gets to like that point, that's when I'll definitely, see a podiatrist. And at least, I mean, podiatrists are definitely trained to do that. I don't know if all podiatrists do that, but They can come in, you can go there, take care of the nails and stuff. That's pretty easy treatment.
Yeah.
Now, in some cases, though, it's not always fungus. Now, when people undergo chemo, their nails can change. They can get thicker because of the chemo. When people have trauma to their nails, or let's say they're very active, or let's say a weight dropped in their on their feet, that can cause thickened toenails, and it can end up being negative for fungus. And in those cases, they just come in as just more routine care, where they're just kind of maintaining the nails as they are. But long story short, I wouldn't necessarily. There's always going to be gimmicks out there, oh, like it's going to go away tomorrow and stuff like that.
Yeah. No,
I find it
that's
doubtful.
super helpful. Thank you. Michael Childs has his hand up.
Yeah, thank you. This is very helpful. I have sports medicine questions. Is it
Sure.
important to see, as you age, are there specialists in sports medicine and podiatry?
Specifically, you mean as you age as well?
Well, like if you don't really have a foot problem, but you're getting older, and you've been running for like 50 years, and
Yeah.
what kind of problems might arise, and how do you deal with them? Do you go see a specialist in sports medicine, or do you come see someone like yourself?
So I would say if it's more the foot and ankle, I would see someone like myself because this is all we do. The vast majority of sports medicine, they're going to be specialized more in like 30 to 40-year-olds, 20 to 40-year-olds, getting you back to like your athletic level. That at least that's my opinion.
Yeah.
I treat people of all ages, and as I said, from a 1-year-old to like 100 years old or more. What I would say where you're going to run into what I see most frequently as people get older, especially former athlete people who have always been active, the biggest thing is that your recovery is going to be longer.
Yeah.
And the issue is people don't want to believe that. So they're like, oh, like I have people who, let's say, they play pickleball every single day. I'm like, oh, my foot's killing me. I was like, you just might need to just take a break once in a while. Like, oh, well, I used to be able to play soccer the whole. I was like, I understand you used to, but unfortunately, that's not the way things work. And so I would say recovery is the number one. That's the first step. Realize that your recovery is just going to take a little bit longer. That's number one. The other part is stretching is going to become more and more important as you get older because everything is getting tighter. Along with that is someone who's very active. Unfortunately, your joints are going to be more prone to arthritis than someone who didn't really do any sports or didn't do many activities because your joints have just undergone more stress. So that means that, like certain movements your knees might be hurting, your back will be hurting, your ankles will be hurting, your arms can be hurting. So a lot of that is just managing that as well. So I would say those are the most common things.
It's if I can ask a follow-up. It seems like a lot of people in my age group complain of plantar fasciitis.
Yeah.
Is there a way to avoid plantar fasciitis?
I would say number one is stretching. And you can find a lot of pretty decent stretches just online. Or if you've ever gone to a physical therapist, they'll have plenty of great stretches for you. The idea is you need to stretch both your Achilles, because your Achilles attaches to your heel, but then also sends fibers down to your plantar fascia. So if your Achilles is tight, it's going to be sending very tight fibers to your plantar fascia, and then your plantar fascia is going to get tight. So I would say stretching is number one. Number two is the shoes that you wear. You need to wear good supportive. I prefer sneakers, nice shoes, and you need support in them. And part of the issue as well is you have to look at your foot as well. So for example, some people might have flat feet their whole life and it may not ever bother them. But the issue is that, as you can imagine, you have a joint like this and it's going like that, and your whole life it's fine. It's going nicely like that. But the issue is now once you have flat feet, it's going a little bit, instead of straight like that, it's going kind of like that. And as a result, your joints are now being rubbed in the wrong places, so it can lead to arthritis. So that's why people may end up needing inserts as they get older. So really, supportive shoes and stretching is very important.
Well, one more, please.
Go for it, Michael.
So what about someone recently told me that my feet have grown a half a size, and that surprised me because I've been the same size for like 20 years.
Yeah.
Why would that happen? Is that, I mean, I run a lot, but like, why would that?
So yeah, I would say I don't think necessarily that your foot has grown. I think other things have changed. So number one, for some people it could be swelling. The other part it could be if your arch is changing. So if you have an arch like this and now it's flattening, now your foot might look longer.
Yeah,
So I mean, it's kind of longer, but theoretically the amount it's kind of longer, but kind of not longer.
yeah, okay.
I mean, I'm hoping that I'm going to continue. I'm going to start growing again. But I'm not sure if that's going to happen.
Thank you.
No problem.
Go ahead, Ms. Patel again. Oh, but you're muted, I think.
Trupti, you're on mute. Trupti, you're on mute.
I'm sorry. Yeah. I have, motor neuroma. Seems like the way you describe, seems like I had it motor neuroma, like
Yeah.
when I had a cortisone injection, I tell. But I had also special orthopedic sneaker from medical store, very expensive. But problem is like the fancy looking ICs is a many different style. You said it's a Atrex something. The company name Women's Essence collection. Where I can get it from? Is there any specifically store name, because there is a more fancy looking, so I can wear it under the dress too. So where I can buy it, and is it medical store or
Sorry. Are you talking more about the insert or the shoe itself?
shoes? There is
The
a
sh-
like a yes, there is a shoes. There's a lots of design of shoes here.
Yeah.
I just took a picture from your.
Oh, yeah.
So
So
is
yeah.
the
So
medical can cover like I mean I paid for my sneaker anyway, so I wouldn't mind to pay again, but where I can get it from?
yeah. So
Definitely one.
so so as I said, every podiatry office is obviously completely different. Some specialize in more things. Louis DeCaro, his office, they specialize a ton in orthotics. And so if you have any questions about orthotics, he'd be 100% the expert for that. Every place is obviously very different. So in regards to those shoes, so those are part of the diabetic shoe program. So people will come in, they'll either be diabetic and they'll get it that way, or they want those shoes. And so we have a catalog and they just pick from there and then we order it for them.
Oh no, I'm not diabetic or I don't have any other issues.
But no, yeah. So you would theoretically, so there'd be just a catalog and you just order from it. So a lot of the shoes that we use now, it's the Ortho Feet. That's the one that we use. And so you can find it online as well. And they have all different kinds.
So whatever the shoes you show it to us like in a meeting, this is the fancy shoes, but there's a inch there's a sole you can put it in, right? There's not I can get any shoes, but I thought there is a shoes like that, a special for the feet problem, for the plantar.
So no, yeah. So those specific shoes are more for diabetic patients. They're softer. So they have to have a deep insole for that.
No, then I'm not going to. Okay.
No, yeah. So otherwise, there's other shoes that are there. Otherwise, there are inserts that are modified depending on what the person's problem is. If I'm like understanding what you're asking.
Okay. Do you have another store like near to the Franklin or Foxborough area that you medical store I can get it from? Do you have any like?
Um, in regards to the shoes specifically, different kinds of shoes.
Yes, like little kind of fancy shoes for people who have
Unfortunately not.
Okay.
Yeah, unfortunately I don't. Yeah, I wish I did. When it comes to nicer shoes, obviously try it on in person. I'm not 100% sure. Yeah.
No problem. Thank you, sir.
Honestly, even around me, I have a hard time finding nicer shoes for myself. Just because even within the same brand, there'd be one shoe that's good and one shoe that's not good. So yeah, unfortunately, I'm not sure.
Thank you.
No problem.
We're close to winding down. If there are any final questions, please, this is the time to ask. So last opportunity for anybody. Emily B, go for it. But you're on mute. There you go.
Hi.
I had a question regarding the laser. You'd mentioned that for the potential toe fungus, I haven't had it diagnosed, but
Yep.
it looks like it. And I was looking into the treatments, the topical, like you said, what I read too was that it hadn't, wasn't a high success rate and takes a long time. You have to be very consistent with it. And then I was reading that the laser treatment does a better job. And I wanted to ask you if that's
Yeah.
your
So
thought.
I would say more in my experience, I would say it's about 50-50. So if topical is about 20 to 30%, laser, I would say it's about 50%.
Okay.
I would say usually the patients that I see who are coming in for now some do come in and they just want laser from the get-go and they do laser. I would say the most commonly what we see is number one, they're either not consistent with the topicals or they from the get-go like I'm not going to be doing it every day. Okay, well then let's do topicals. Or sorry, or let's do laser. Other people might have an allergy to the oral medication or they have an allergy to the topical medication. So that's another reason to do the laser. As I said, I would say it's about 50-50. It's not 100% either. And unfortunately, with the different fungal treatments, nothing is 100%. So just kind of keep that in mind. Now, maybe you might go to a podiatrist and they say in their hands it works 100% of the time. And if that's the case, that's great. But in my hands, I would say it's about 50-50.
Yeah, I was gonna go to a place that was closer by, but I called and they don't have the laser. It was Dakara what was mentioned earlier. I was
Oh,
thinking,
okay.
so,
Now,
and
also people change too. You know, they might have had the laser in the past and they just decided to not do it or whatever.
Okay.
Yeah.
So the closest one that I found is in Worcester, Mass.
Do you remember who runs that?
It's called Central Massachusetts
Oh,
Podiatry. I don't
yeah,
know.
I know them well. Yeah, so I trained under them. They're very good there as well.
Okay.
And
Yeah, I don't have a name
they
for
do
somebody
laser
though.
there.
Yeah, that's the closest I found here.
I see. Yeah. Unfortunately, that doesn't surprise me given that area.
Okay. All right, thank you.
No problem.
Last hurrah. This has been fabulous. We really, from an Amherst Neighbors side, just want to say thank you, Dr. Gorelick. You're an encyclopedia of information about
Oh, no problem.
all things foot care. So we're glad to have stumbled onto you, and glad that we had a couple dozen folks signed in to learn about the importance of good foot care. Very thorough. Thank you, and I'll turn it over to Rahul to wind it down.
Yeah, for sure. Thank you so much to Dr. Gorelick. It was a great presentation, and thank you all for attending as well. We really appreciate your attendance, and if you liked programs like these, we look forward to partnering with Amherst Neighbors for more in the future. And if you would like to check out more from volunteering for seniors, I've included in the chat. Should be further up, but I can add it again. I've linked our website as well as an email address for you guys to email if you would like to be added to our email list. And that connects you with more events that we have and continued support from volunteering for seniors. So if that's something you're interested in, definitely send us an email. Again, it's info@volunteeringforseniors.org. You can find that in the chat as well. I'll link it again. And you can also check out our website for much more. So again, thank you so much, Dr. Grelick, and thank you to everyone
No
for
problem.
attending.
Thank
Job
you.
well